Today we're going to talk about Alphabet's Verily, and I'll just say this right up front. If Alphabet's Verily does not have any haters, then I have died. So who is Verily? What is Verily? Verily has our 5-year, $38 million contract at the CDC for COVID wastewater surveillance, where the contract is limited to them collecting data for COVID-19 and Mpox out of its South San Francisco lab. Now, for a little bit of grounding context, BioBot Analytics is who had our COVID wastewater contract, and I personally felt like they did a phenomenal job. So as of September 27th, 2023, this contract ended abruptly, and Mandy Cohen introduced this new contractor, Verily, which is formerly Google Life Sciences. And this was one of the first actions that Mandy Cohen took, and it's probably the worst one that she could have started with. So in October 2023, Mandy Cohen awarded this 5-year contract to Verily, a life sciences company affiliated with Google, where to this date, we still don't know why the CDC did this change, but the only thing we can really guess is that the cost is what was the major factor. Verily was able to dramatically underbid BioBot Analytics at $38 million for this 5-year contract, making it considerably less expensive. However, again, there was no bridge period in the contract set up, so BioBot Analytics just got immediately cut off. Verily got immediately started up, so there was no way to bridge the data from BioBot Analytics to Verily, so all of that data was lost. That historic data was just disappeared. Where the other side of this problem is that because of this dramatic switch that Mandy Cohen initiated, there then became a legal contracting dispute because BioBot Analytics had fulfilled all of the terms of their contract. There was no reason to have them have lost the contract because they hadn't done anything wrong. They didn't not meet their goals. They didn't do anything that would have them lose their contract. So this ended up creating a contract dispute, a legal contract dispute that Mandy Cohen ended up calling it a contracting situation. But this created a transition period where we didn't know which company was going to be able to have this COVID wastewater contract, because it was originally just assumed that BioBot Analytics would continue doing it for the next 5 years. So it ended up creating a very bad situation, which I'll show in a little bit. Now, this is not the first time that I've talked about Verily and this contracting situation, because if you go to this playlist right here on my YouTube channel, Erosion of COVID Wastewater Surveillance, and you go to this video right here, the BioBot Analytics loses 5-year wastewater to Alphabet's Verily, I sort of broke this situation. I was, I think, the first person that found this out. But if we go over to the BioBot Analytics to Verily COVID wastewater switch, we can look at what the data was when they won this contract, because it was pretty abysmal. So if we went to the Verily's website, this is what they had. Basically, they had a visualization that looked like this, that was pretty much garbage. You couldn't do anything with it. It's still not much better, but you'd look at it and you'd be like, what the hell? But it was really just a transposing of the wastewater scan data from Stanford and Emory. So this was like, okay, so what are they, how did they win this? They don't have anything. They don't have labs set up. They don't have all of this stuff. They're just basically copying and pasting data from another website and making it worse than what the other website did. So why did they win this was the question. Because if you recall what BioBot Analytics was doing, they were taking data from all over the US. They were providing a state-based allocation. You could go within each state, find different counties, and find the closest local county to you that was measuring COVID wastewater. They would aggregate this into different regions and then would have a national trend as well. So you're able to see in real time the COVID wastewater data updating within your state and your local counties. But not only did they do that, but they were also expanding sites within the NWSS program, and they were also doing correlations with hospital patient data. So they were correlating the wastewater signal with the case count, the documented case count. So that would give you an estimate of, based off of the wastewater signal, how many people are currently infected with COVID. This is something we completely lost after early 2023 when this wastewater contract shifted over, because wastewater scan does a completely different calculation and methodology, and we also lost pretty much all of the biobot analytics sites that were doing this prior. So we lost this ability to correlate wastewater signal with case count due to this contracting switch. And not only that, but they were also documenting all of the COVID variants in the wastewater. So they were doing wastewater tracking by state level, by county level, by region level, nationally, and they're also providing COVID variant sequencing data all within their program. But all that Verily does, if we go over to their website today and look at all available, is they only have a national and regional thing. They do not have it broken down by state or county. They haven't expanded. They've actually lost sites since they took over the contract, and they don't have anything outside of the wastewater scan program on their website here. Jumping back into this story, so back in February 2023, BioBot had been given a 6-month extension to ensure the data continuity for the NWSS program. So they had come up to the end of their contract, they had been given a 6-month extension, and then it was basically thought to be a shoo-in for them to get that next 5-year contract. And during the time that they had been taken over, from April 2022 to February 2023, BioBot had enrolled more than 400 locations into the NWSS program from over 250 different counties across a total of all 50 states and including U.S. territories, providing additional coverage to more than 60 million people nationwide within the program. And in addition to this, BioBot Analytics had their own labs that they were sending the data out to get processed to make sure that all these different regions could have accurate and timely up-to-date data, which was important because at this time they were winding down clinical data collection. So this was around the introduction of rapid antigen testing. So remember that whole push we need these rapid antigen tests. If you have if you're sick, stay home, take a rapid antigen test. But then they weren't collecting this data and adding it into the statistics. So they're saying, we can't trust the clinical data anymore because we have all these rapid antigen tests and people aren't reporting them, when there really wasn't a system for people to report them. And in the few cases where there were state-run systems that did collect the data, they didn't actually keep the data. So you'd submit it through that website, say, hey, I have a COVID positive test, you'd send your picture of it, and then the state actually would not collect the data. I went and did a data request through a lot of these states that had these programs set up, and they said, we do not have access to this data. I could show you guys that if you want in the future, but they did not actually collect that data, so it was never aggregated. So as the clinical data was decreasing, and now in 2025, we actually don't have any requirements for reporting COVID cases. The only thing is through Medicare and Medicaid, but even that is in dispute right now, so it's not necessarily fully required in most places. But essentially, we don't have COVID data tracking in the clinical sense because it isn't required anymore. So as this is going down, it was even more important to have the wastewater monitoring signals be continued on and kept the same so that we could correlate this to case count. But because of this switch, we can't do that anymore. And then the next part of the story is that during this contracting dispute, because of Maddie Cohen's poor decision-making skills, about a quarter of the nation's wastewater testing sites were shut down indefinitely because of this contracting dispute. And during this time, the first thing that happened was that BioBot filed a protest stymieing the transition. And what this meant is that while this was being litigated, the transition was on pause. So BioBot couldn't do work and Verily couldn't do work while this was sorted out, which meant for a lot of our winter wave, we just didn't have data because of no one being able to collect and aggregate and publish it. Now, to give you a sense of this contract and how much Verily underbid, BioBot's most recent contract was for about $31 million over less than a year and a half, while for 5 years, Verily was saying, we could do the same work for $38 million. So to put that in perspective, for a year and a half of work, $31 million, put that out to 5 years, that would be about $100 million, $103 million. So Verily was saying that they could do the work for $65 million less than BioBot. So during this time, the 1,200 sites that were part of the NWSS program that were CDC controlled could continue operating, but the over 400 facilities that were BioBot Analytics controlled and operated, those could not perform any data collection, which again meant that our winter 2023 wave that went into the 2024 year was inaccurate because a lot of the sites that were reporting data in the past were no longer reporting that data. The second thing was happening was sort of unscrupulous business tactics by Verily. So what they were trying to do was buy out sites from Biobot Analytics to steal away their data and to steal away their resources in data processing. So here's an example here from some sites in Vermont. So Fisher said that Verily offered the South Burlington wastewater facility about $15,000 a year for the sample collection, although he was not clear on whether all the Vermont sites were getting paid. South Burlington is still sending data to Biobot, but plans to stop doing it when it stops being free. So if they would have to start paying for their own collection services and then shipping it out to Biobot, they were going to stop doing the data collection for Biobot. But this is an example that Verily was trying to literally buy out the wastewater data services from Biobot by paying for it out of the new contract. And for the most part, it worked. The 3 wastewater systems in Vermont, South Burlington, Essex Junction, and Montpelier, are now also sending wastewater samples to Wastewater Scan. So South Burlington, while it seemed like they took a stand, they actually didn't. They're like, oh, we're going to double dip. We're going to still send data to Biobot because we've had this ongoing relationship with them, but we're also going to take your $15,000 a year because thank you next. And of note, Verily isn't even doing the data collection and processing. Wastewater Scan through Stanford and Emory University is the one that's actually doing that. So while Verily won the wastewater contract, they're not actually doing the work like Biobot Analytics was. They're sending this out to their quote-unquote subcontractors, even though they're not directly paying for it. They're doing a philanthropic gift to Stanford University and Emory University through the Wastewater Scan program, but in essence, they are subcontracting the work out to Wastewater Scan. And we can see that right here in the About section of the Wastewater Scan page, that these data were collected as part of the Wastewater Scan/Scan project, a partnership between Stanford and Emory University, and Verily funded philanthropically through a gift to Stanford University. So it's, in a way, subcontracting out the work to Stanford and Emory from Verily. And on their website, they claim that partner labs at Verily are doing the wastewater data processing and analysis, but I'm not one to believe that, because in all of the major news articles, they're saying that the data is being sent to the Wastewater Scan program and being run and processed there, not through Verily. And to further support my belief, here's another article from 2024, June 2024. So this is a while after Verily has officially won the contract, where right here it says, since the pandemic, Verily has established itself as a key player in U.S. wastewater surveillance. It has joined forces with Wastewater Scan, a partner between Stanford and Emory University, to track a slew of pathogens over 190 sites in 36 states. This past October, the Centers for Disease Control and Prevention also tapped Verily to be its partner in monitoring more than 150 other locations, a $38 million contract. Now, the problem with this is that while there were 192 facilities that were a part of this program, if we look over here, we see this little trash icon, this little garbage bin that says data is no longer collected from this site. So since they've won that contract, Verily, and have been using Wastewater Scan has cut many of their sites. They've whittled down from 192 to 148 actively collecting sites. We'll just do a quick scroll, make sure that's still true. Yep, 148 collecting sites. So they've lost a lot of data since Verily has won over this contract, because they've decided to expand to all of these other viruses. And to do that expansion of these viruses, they had to whittle down their programs to do the cost offset balance. However, again, that's not what Verily was contracted for. They were contracted for COVID and Mpox, not all of these other things. And that's where the annoying legal loophole comes in of Verily funding philanthropically through a gift to Stanford University, because this wastewater contract being gifted to to Stanford University through the Wastewater Scan program makes it so that Wastewater Scan is not limited by the constraints of the contract. So let's look at the data and see what the difference is between Biobot Analytics and the NWSS program when Biobot had the contract versus now when Verily has the contract. So At the peak of the number of sites, there was 1,587 sites in the NWSS program when BioBot Analytics had the contract, and since then, we've dropped to 1,152 sites. So we've lost 435 sites since Verily took over. In theory, these could be all BioBot Analytics run sites, the 435. I don't think it's entirely all of them, but we know that BioBot Analytics had enrolled over 400 sites to the program, so I'd say this is probably a good estimate that these are, in fact, the BioBot Analytics sites. So I'll put a little question mark right there that were completely lost from the NWSS program. But on top of that, we have a huge swath of sites that are not reporting data consistently. So currently we only have about 965 sites that are reporting data, meaning from the peak, we've lost 39% of the sites that were in the program when BioBot Analytics was running the program versus now when Verily is running the CDC contracting program. And if we look at the actual Verily sites, so we can go into this key plot and just pull out the Verily sites and the Wastewater scan sites. So Verily only has 145 sites that are currently in the NWSS program. So if we strictly just look at Verily run sites compared to BioBot run sites, so there is over 400, we'll use 400 as a conservative number. That means that there are 255 less sites that Verily is operating than BioBot had, which means that Verily is running only 36% of the sites that BioBot Analytics was running. Now, even if we're the most generous and we also include wastewater scan sites into Verily, even though wastewater scan would be directly providing the data, not Verily in this, and since they want to keep this legal separation between the two, we technically shouldn't. We should only give them a 145, but wastewater scan has 118 sites that are currently reporting data to the CDC, which is weird because they're collecting data from 148 sites, so 30 sites apparently aren't sending data out. Maybe these are 30 sites that are being operated by Verily, so maybe that's contributing in that number there. Not really sure what's going on there, but best case scenario, they have 263 sites. So again, using 400 as a conservative estimate, that means that they have 137 sites less than BioBot Analytics did, which means that it's only about 66% of the capacity that BioBot had in the best case scenario. But we know that that's not true since they want to do this legal difference. They only have 145 sites, so they're only operating at a 36% capacity of what BioBot did, which makes sense because they're going at, I think, what was it, like a 32 or something like that percent capacity of the money. So clearly they could not operate at this level. And the theory at the time was that they wanted to do additional data processing to get data out of this. So one of the things that like BioBot actually won a contract for was tracking drugs and opiates within the wastewater, because you can extract not only the diseases, but you can also look at metabolic profiles. You can look at the types of drugs that are being used in a community, like pharmaceuticals and otherwise. These are all things that you can look at. So that's the theory of what Google was really after, and that they were going to fund. Like, we knew that Verily was going to be operating at a loss by doing this if they were actually going to be doing what BioBot was doing, which is how they were able to underbid by so much. So that was the theory at the time. So clearly they are operating at a diminished capacity because they're working off of diminished funds than what should have been used for this effort. And this leads us into the present day, where Alphabet's Verily is having dramatic issues, where in August 2025 of this year, Alphabet's life sciences arm Verily is laying off staff and shutting down its entire medical device program, where they're shifting to a precision health platform and data around an AI strategy. And outside of these layoffs, then we found in early September, mid-September, that Alphabet's Verily is being sued by former executive over alleged HIPAA breaches, where personally identifiable health information of more than 25,000 patients was misused, where Verily failed to disclose this breach, delaying notifications while contract renewals were negotiated with the affected covered entities. Which brings us to now in early October, where Alphabet is preparing to now sell the life science unit Verily or to just let it be its own spin-off company, where Google is in the process of helping them become an independent company, with the idea of it no longer being an Alphabet entity. So in terms of how Verily is going to be managing the wastewater contract, it is currently unclear. We know that they've had massive layoffs in their sector, which has impacted their ability to actually run these programs. We know that they are currently under a major lawsuit due to HIPAA breaches within their core units, and Google is now looking to completely divest from them, letting them be an independent independent company, so that they can now deal with their issues on their own. So it's very unclear if they're even going to be around within the near future, and they still have 3 more years on the COVID wastewater contract. So they're really not putting their best foot forward, and it looks like this is going to be a very major issue for us in terms of continued COVID wastewater monitoring.